Podcast 22, Week 24. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 24. Baby grows an amniotic fluid inside the amniotic sac, inside the uterus. It's sometimes called your bag of waters. The sac provides a place for baby to move easily and also cushions against injury. Fluid helps baby's lungs, kidneys, and gastrointestinal tract develop. It also regulates temperature. We've talked about your doctor measuring you at prenatal visits. Measuring you will probably be done at every visit from now on. Your doctor measures you to see how your uterus is growing and whether it is too big or too small. Being too big or too small can be an indicator of problems. Do you have a stuffy nose or frequent nosebleeds? These problems may occur because of circulation changes caused by pregnancy hormones. It may help you if you use a humidifier. Some women also find relief if they increase their fluid intake or use a gentle lubricant in their nose, such as petroleum jelly. A few decongestants and nasal sprays are okay to use during pregnancy, but before you begin using any product, talk to your doctor. Depression can occur at any time during a person's life. If you have a history of major depression, you're at increased risk of depression during pregnancy. If you're being treated for depression when you get pregnant, continue treatment. Treating depression is as important as treating any other condition. Don't stop taking antidepressants unless advised by your doctor to do so. Even if you haven't been depressed before, you may experience depression during pregnancy. Up to 20% of all pregnant women do. Left untreated, 50% of those women will experience postpartum depression. It can be hard to tell the difference between some normal pregnancy changes and signs of depression. Many symptoms are similar, including fatigue and sleeplessness. The difference is how intense symptoms are and how long they last. Take good care of yourself. Talk to your doctor and follow his or her advice about dealing with depression. When you do, you're taking care of baby too. Moving to a new city can be stressful. When you're pregnant, it can also be challenging. How do you find a new doctor? What hospital will you use? Before you move, contact a real estate agent in your new town. Ask him or her to help you find a hospital in the area. Ask about one with a level 2 or level 3 nursery. These hospitals are better equipped to deal with pregnancy and birth complications. Then call the labor and delivery department of the hospital and speak with a supervisor. Ask for recommendations for 3 or 4 obstetricians who deliver at the hospital who are taking new patients. After you get some names, call the offices. Do this as soon as possible because it can take some time to get in for your first appointment. After you decide on someone, go to your current doctor and ask for copies of your medical records. Be sure they include results of any tests you've had. Take copies of everything with you. Sending records can take a long time. Ask your current doctor about taking any tests you're going to need soon. When you do, results can be sent to you at your new address. It can also help your new doctor if he or she has test results when you go for your first visit. Many women are concerned about eating out. What can they eat? The best types of food to eat at restaurants are those that are okay to eat when you're at home. You might want to skip restaurants that serve highly spiced foods, food high in sodium, or food loaded with calories and fat. We know you don't want to avoid going out completely. That's no fun. Just be cautious and selective when you do eat out. You'll probably feel a whole lot better. Pregnancy can change a lot of things for an expecting couple. We found one is a change in sex drive patterns. Generally, pregnant women experience one of three patterns. One is a lessening of desire in the first and third trimesters, with an increase in the second trimester. The second pattern is a gradual decrease in desire as pregnancy progresses. The third pattern is a heightened sex drive. A woman may experience orgasms or multiple orgasms for the first time during pregnancy. No matter which sex drive pattern you and your partner experience, keep in mind it's all part of pregnancy. An incompetent cervix refers to premature opening of the cervix, which usually results in delivery of a premature baby. The woman doesn't realize her cervix has dilated until baby is actually delivering. Diagnosis is usually made after delivery of a premature infant without pain before delivery. The cause of cervical incompetence is usually unknown. Fortunately, the problem is relatively rare. If this is your first pregnancy, there's no way to know whether this will happen to you. Some experts believe it may occur because of previous injury or surgery to the cervix. Treatment involves closing the weak cervix with a suture, similar to a purse string, which is stitched around the cervix to keep it closed. Around 36 weeks, or when you go into labor, the stitch is removed and baby can be born normally. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.